We're here at the Healthcare Scene After Party. We're talking with Dr. David Rhew, Samsung's Chief Medical Officer, talking about what's coming up at HIMSS 16, what Samsung will be doing, any other innovations that we'll see. So we just talked a lot about a number of things, but one thing that probably deserves a little more attention is the issue of integration between mobile devices and between wearables, between Internet of Things. What do you see happening in the integration side of things with all these devices?
Yeah, well, integration is the challenge in all of healthcare IT. It's something that we know is challenging because there are established platforms already, and each organization has as a key reason for sticking with that, and to promote interoperability is a good, noble concept, but from a business perspective, it's not necessarily something that a lot of organizations are embracing, unless they find themselves in a position where it becomes a competitive advantage. And so we have seen in certain scenarios, certain groups banding together and enabling some of that interoperability within that ecosystem. So I wouldn't say it's completely out of the question, but would in all likelihood drive the greatest speed to interoperability would be government intervention to try to require certain standards.
Interesting. It's from a meaningful use perspective, which we've just gone through. Unfortunately, they did it the wrong way. I've seen it done the right way in other industries. So I think in healthcare, we're a little reticent to think that government could help us with the interoperability standards. But I know in other industries, in other areas, it's worked out okay. So
right.
Welcome, Dr. Jimmy. That's your new name. Is that all right, Dr. Jimmy?
Hi. Yeah. Jim's fine. Jimmy, I answer to anything. And thank you for having me on, John and David. I tell you, this has just been wonderful to see the questions and answers, and just great to see the back and forth banter. And I think what I don't
know, give him a little background.
Yeah. I'm an internist. I'm an internist in private practice here in rural Montana. I've been here 23 years, and I was kind of late to the party integrating electronic records. I started that at the end of 2011, and through steps and phases, I've integrated a patient portal system that's been very, very helpful and useful. Get over 800 plus patients actively using a portal out of 1,100 patients in my private practice. And a couple of years ago, thanks to my then 13-year-old son, and this is the part I wanted to talk to you about, David, is it's very crude, very simple, but it has been extremely useful. And what I do is I share the electronic record on a wall-mounted screen, 24-inch screen that's HDMI corded to my Chromebook. And my Chromebook, then I use VNC Viewer that attaches to my dual monitor desktop. So that's how I get to my CRM, Health CRM, and my electronic record when I'm on my Chromebook. So it sounds a little complex, but rather pretty simple. But what I'm able to do is integrate real-time data with the patient. So I turn the EHR into an interactive educational format. And what I'm envisioning is these wearables. Right now I can integrate blood pressures, BMIs, blood pressures, very simple graphs over time. Get it? It's a wonderful way to integrate this information. But as I see over the next several years, I think we're going to have approaches like I'm using at the point of care, where we turn the electronic record with these device-fed graphs of much more sensitive, intricate information, and be able to share that in real time with the patient. That's what I think will be happening over the next several years. I don't know. I'm just a grunt from Montana, but the system I've been using, just with the simple graphs of these vitals, and being able to do that in real time and make it really meaningful for the patient in a visual way. It really has been a lot of fun over the last couple of years. So, sorry, that's a little long-winded introduction.
Have you seen some examples of that, Dr. Rhew, where doctors really are projecting the EHR or other data for patients?
Absolutely. Jimmy, you're an army of one in Montana leading the charge. That's awesome, because what we're finding is that what you're doing is very consistent with what other healthcare organizations and physicians want to do, which is to transform the EHR experience from one in which your back is turned to the patient, you're entering information in, to one in which there's a conversation and in which you actually have an ability to share information that's meaningful to both. What we've found is that the mobile tablet in particular is a great vehicle to do that, because it forces you, because it's not something you would readily enter information on. You would maybe enter a few check boxes and things like that, but you have to have that conversation with the patient. And then if you can capture certain key elements, it's stored in a template. It allows you to be able to then expedite the note writing later on. Yes. So what we're finding is that's a real nice vehicle for us to be able to start thinking about how we change the paradigm of doctor capturing information and typing it with the back. Now, the other thing is that we also have found is that the displays that are in an office room are an exceptional means to provide that level of collaboration. So we have a large health system in the East Coast that wants to transform the way that they do consultations for surgical and radiology types of diseases. So if, let's say, an individual had a new diagnosis of a cancer or needed a surgery, typically this is done where you'll either show the film or maybe on the computer you all gather around. Now you have an ability to actually shoot it up onto a big screen. You can annotate it on a tablet. You can even save that image and email it to them. So we've got a truly interactive platform where a patient, their family members, and even the rest of the healthcare team, you may find this is great, where you've got individuals potentially even need to do teleconferencing and annotating on the same type of documents, all in front of the patient, and all something that's very focused on getting the patient's feedback and information. So I think we're seeing changes today. A lot of these technologies are great enablers, but it does require us to think about how our workflow is and what's the best way that we can change it to have the patient still at the center of care.
And I just wanted to just follow up, and then I'm going to concede to, the floor to the workflow expert, but Charles. But what you said, David, is I've been doing this for just a little over 2 years, and I call it projected EHR. And the electronic record that I use, I do very little data entry at the point of care with the patient, very little. And what I do is review like the past medical history, social. I do all my own medication reconciliation and look over the U.S. task force recommendations. But in terms of data entry, I do that away from the patient. But using those, going over that information with the patient, it's been a very educational moment. HL7 imported lab, hemoglobin A1Cs over time, you can see the changes in the results. It's really cool to see. So I wanted to echo that. The other thing I've been doing is that I can then, with my dual monitored capability with the VNC viewer, I can actually put on the, say a patient comes in with an abnormal chest CT, we actually look at the abnormal chest CT together, put the report up on the other side of the screen, and I can swipe back and forth on the Chromebook. So it's a really simple, effective way to do what you're describing. But I've had a lot of fun with that, and I can bring the whole patient and family in with a new diagnosis of an abnormal chest CT. They can actually see the results themselves, and seeing it, reading the report, seeing all that in real time makes a huge difference in terms of, I think, understanding the process at hand.
Absolutely.
Well, so thank you.
Is there a reason you use the Chromebook instead of a tablet? Is it just your EHR interface doesn't work great on the tablet, or have you?
I got it for a Christmas gift, and then the other thing.
Don't get me wrong, but if you're not doing data entry,
it's cheap, it's durable, and I like the VNC viewer made for Chrome. It's encrypted, and all I do is I use it like a. I guess the proper term would be. I'm not sure exactly, like a thin client. So all I'm doing is connecting into my main database with the Chromebook, and I don't like to go out onto the internet on my regular computer. And what I do is I flip in and out of the VNC viewer made for Chrome. So I click out of the Chrome, the VNC viewer made for Chrome, which uses, attaches to my main database, and that's Microsoft dependent, whereas my Chromebook is Linux kernel. So anytime I go onto the internet, I use my Chromebook, get out of the VNC viewer made for Chrome, and then I don't have to do anything to the Chromebook. It's dummy proof. I don't have to do any antivirus, don't have to do anything. And then if I get anything, I can do a clean wash. And then if something happens to my Chromebook, for about $200, I can replace it. And I've done that recently. So it really minimizes the downtime. It's just a cheap, affordable tool with a keyboard, 14-inch matte screen, and it works for what I need. But I'm not opposed to tablets and other things. You know, there's more than one way to skin a cat. It just works for me. So
yeah, Samsung just launched, is actually, I think it may have been just this past month, our 2-in-1. It's a Microsoft-enabled tablet. It's basically something you can do all the work on a tablet, but then you can plug it into a port which has the keyboard and allows you to be able to do what you need to do. And it folds into basically like a laptop.
That'd be excellent. Yeah.
Nice.
Kind of a neat little device.
Because the tablet, I mean, you can also do the tablet up using Chromecast or some of the smart TVs. You can often sync them and, have the display even better than plugging in the HDMI, I think.
I tried the Chromecast. One thing I was concerned with, and you could certainly do that, was, if I walk out of the room and I leave somebody's record up on there with the HDMI cord, I unplug it. I have a little 8-inch extender. I unplug it. Then I know that I'm not going to do that. So it's mainly out of concern of, but I'm sure you could use a Chromecast. Absolutely.
So many options. In the Chromecast, you might question the HIPAA. I'd have to dig into that one.
Yeah, I'd have to look at that too. I'm not sure how secure that would be. I know with the HDMI cord, it's just.
Yep. Well, let's welcome in Chuck Webster, or Dr. Chuck Webster. I forget his official title. Thank you, Jimmy.
Thank you. I'll jump on.
Jimmy, stay on.
Oh, okay.
For a second. I just want to. I'm on here because Jimmy got on here, and I couldn't stand it. I had to get on too. Anyway, a little bit of noise in the background here. Jimmy, I'd just like to point out 2 or 3 things about Jimmy that I think are the doctors and people who design electronic health records and policymakers can learn from. And that is, first of all, Jimmy is joyfully practicing medicine using an electronic health record. Okay, I mean, there's so much, and I find that fascinating. I mean, I've
it's sad that it's true.
Now, Jimmy will automatically kind of focus on the projected EHR, and it's a great idea. But the 2 or 3 elements of Jimmy's success that I just want to kind of highlight here, and then I'll get off, is first of all, his electronic health record was actually designed before meaningful use. They did not use the meaningful use certification requirements to design it. It was designed by a physician before meaningful use. Now I believe it's certified now, but you tend to see the EHRs early on actually had much higher satisfaction. Second of all, he has a very interesting setup. His patient portal, I believe, is based on a kind of a customer relationship management model, CRM model, and I believe the workflows are relatively customizable in a kind of a classic workflow management system sense, although CRMs and business process management systems are different animals, but they're both process aware. They have representations of workflows that can be edited and changed by people who aren't programmers. And they're very transparent. You can track status and so forth. So his nurse is really an intelligent workflow engine who just kind of swivels back and forth between the EHR and the CRM. They really aren't that integrated at the data level. And so I think there's a kind of a workflow interoperability notion there. And the third thing is this, and that is that although Jimmy denies it, Jimmy is a tinkerer in the kind of maker sense. You've been to Maker Faire, or you hear about the 3D printing and Arduino people building, going on Kickstarter and building products and companies. And Jimmy is very much in that mode of tinkering with his workflows and not being afraid to jump in to try new technologies. I'd love to send an anthropologist to live with Jimmy for a week and just sort of document and psychoanalyze and see if we can figure out how to can that and sell it industry wide. So that was just my personal giving props to why I find Jimmy, aside from his being a charming fellow and a fun guy to be on Blab with, he's really potentially quite a role model. Anyway, I'm curious, Dr. Rhew, if any of what I said resonate, or what do you see in physicians that can be duplicated and sort of you combine IT with joyful practice of medicine?
Well, first of all, Jimmy, I appreciate your enthusiasm, your passion, and your ability to kind of take what you've learned and tweak it and continue to make it better. It's something that I wish all of us could adopt. What I have seen today is many physicians are not satisfied. They're not satisfied with the requirements that are put on them in terms of number of patients they have to see, certain time allocations, certainly the administrative load. Electronic health record has changed their workflow in ways that they are now being asked, what's the value of all this? And I think we're also seeing a good number that are moving to scribes. They're just having other people do it.
Yeah.
And again, when you think about what's the purpose of the electronic health record, to help reduce cost, improve patient care, and here we're adding cost by adding more people. It just seems so counter to what we're trying to accomplish that sometimes I wonder, do we need to take a pause and figure out what is it exactly that we've created, and how do we do a course correction here?
Yeah, and I think we're only going to get better. I really do, Dr. Rhew, and I want to personally thank Chuck for that. That was very kind of you to say all that, and that's very meaningful, and I appreciate that. But I struggled in the paper world for years, and I never thought I would even be doing what I'm doing several years after integrating the electronic record. But I think we're on the verge of really fundamentally changing how we view what the major function of the electronic record is. And I think once we incorporate it as an educational, interactive tool at the point of care, I think a lot of these sensors and devices that you're developing then, I think, becomes so much more, where you can fine tune it and integrate it to make it meaningful to that particular patient right there in front of you. But I think the electronic record can be our best friend by being able to share visually with the patient, so we can incorporate some of this more developed information over time. What I'm doing right now is very crude, but I think you have to get to that crude point and then work from there as time moves on, is my own opinion. But it's what I'd like to do next, and that's one of the reasons I posed that first question, is to now integrate telemedicine as a function of my portal as my next step, which I think in a large rural state would be very helpful out to patients out there. Excuse me.
Absolutely.
So you really just described, let's change the EHR from a government data tracking mechanism into a care engine, right?
Absolutely. And why not? We can do that. I think we can do that. We just have to take the bull by the horns and make this technology, we don't want to be led around by the nose by the technology. We have to take ownership, put a saddle on it, bridle on it, and make it work for us. And I think we can do it. We need to get a little smarter over time and find the interfaces that work best for whatever type of encounter we're doing each and every day. And I just happened to luck out. I had several really lucky breaks, and one was finding the electronic record that works with my workflow. The other was having a smart then 13-year-old kid showing me the mirroring effect of a Chromebook and getting that for a Christmas gift. But no, I just Dr. Rhew, I really appreciated John's questions and your answers. I find this a fascinating time to be in medicine, and I really appreciate you getting on the Blab and being able to meet you and hear your perspectives, because I bet what you're doing is I bet you can't wait to wake up every day to figure out something new to do. So appreciate all your work and effort. So.
Well, there's nothing more rewarding when you feel like the technology is being geared towards the group of people who are most important, which are the patients and the folks that we're designing our entire health systems around. And I think the things that we are finding is that these digital technologies, while they have great opportunities for the healthcare provider side, when you start realizing that the greatest opportunity to improve care is around patients and consumers and prevention of illness, that's where you start realizing, wow, we have a huge opportunity in front of us. And question then is, how do you make it engaging enough so that people will actually want to use it? And this gets back to what we were talking about earlier. I don't think it's all about health. I think it's about lifestyle. It's about workflow. It's about entertainment and really finding value above and beyond simply the healthcare piece. Once you have that in place, whoa, you've got a wonderful platform to be able to do so many things. We work with a project where we have seniors in assisted living facilities, and we've given them a specifically designed tablet that simplified elements of the way that one interacts with it. And in that experience, we realized that we had individuals that absolutely could not get it and didn't really like tablets and didn't like technology. But when we did those configurations and we gave it to them, they realized that, wow, I could go to Google. I could look up stuff that I'd never looked at. Facebook, wow, I looked up people who I'd never even found. Skype and all these tools that were previously unavailable to them. It became something where literally we created what they were themselves calling addicts to technology. 5-year-old, 90-year-old individuals that were spending 12 plus hours per day on these devices. And then you think about the fact that, we struggle with trying to find ways that we can provide reminders, and the reminder is going to go to some kind of a wearable that's sitting on the shelf, or they're never going to get it. When folks are using these devices for 12 plus hours a day, or they've got a wearable that they can't take off, they're going to know. You're reminding them, and now you're a part of their life. And this is where we really do think that the consumer experience becomes a critical part of this health.
And Dr. Rhew, did you say those are elderly Medicare age patients in assisted living facilities?
Absolutely. In fact, we ran a study with 225 low-income seniors who had little to no technology experience, and we gave these configured tablets. They're called Breezy. And we ran it with the National Coalition on Aging. The first thing we realized is that the engagement levels increased dramatically. And then when we layered on programs, really simple programs like, okay, everyone, for the next week, we're all going to walk 2 blocks, and enable people to share their feedback through some, real simple, social media. The level of participation and activity increased dramatically. And so when Columbia measured their physical, mental, emotional, all the different parameters, they found dramatic improvements. And what we realized is that it's the platform, the engagement platform that leads us to the opportunity to then layer on health programs that can be very impactful.
And same experience I had when I started this 2 years ago. I thought it was going to be a total wash when I hung up. It happens to be a Samsung TV, wall mounted on each exam room. But I thought it was going to be a bust. And what I found was that the medically complex elderly Medicare patient were the ones most interested in this approach. So it's just echoing what you're saying there. So I'm going to hop off because I got to let someone else get on here.
Nice talking
somebody, but I don't want to I've monopolized enough of you guys' time, and I do appreciate your time. So thank you. Thank you both.
You're great, Jimmy. Chuck brought up another point that I think relates, because what you're talking about goes back to our previous conversation, that you have to integrate more than health. And then the second point you made was we need people working at the top of their license. And when you look at what Jimmy's done with his nurse, which Chuck talked a little bit about, that is the key, right? Because Jimmy's doing what he does best, which is being a doctor, and his nurse does what she does best, which is help facilitating the discussion, care management, all of those functions. And so, the technology facilitates doctors being able to work at the top of their license and nurses working at the top of theirs, et cetera. So interesting. We've come full circle.
Absolutely. So much of it falls back onto just simple workflow and considerations that we hadn't even thought of. Today, it's still too provider centric. I don't feel like the patient, as much as we want to make them the center and try to involve them, there are elements of what we do that they still are more passive recipients of care. And if there's a way that we can somehow give them the information they need to become more active, empower them with tools that allow them to be able to stay in closer communication, then we've got an opportunity to dramatically change the way that we deal with these issues.
Yeah. Stephen Shannon said, amazing data. You know, I think he's talking about the data from your senior assisted living study. He said, amazing data as my brother-in-law is in assisted living and he is a former electronic laptop auditor who just does not get it. And what's interesting, I think that applies to young people as well as old, right? If the interface is wrong, if you're providing them the wrong tools, if you frame it the wrong way, then you're going to have trouble regardless of age.
Right. And when I talk about configurations, it's not just simply making this font size bigger and you know, kind of, you know, removing the clutter. There's a certain amount of simplicity that can be brought into it. So like, for instance, we're doing a Blab. And as part of this, I'm video conferencing with you. And if I wanted to communicate with you, I go to the Blab. Let's say I wanted to communicate with another one of my colleagues on Skype or maybe another on Google. I can figure that out because I know that this is where to go. But when you ask someone who's not as tech savvy, you know, to communicate with them, and they have to figure out all these different applications, all they want is they want a picture of the person and a little video button. And then they want someone in the background to figure it all out. Well, that technology exists today. And that's something that when we figure out how we can leverage that ability to customize and simplify that experience so that all the inner workings of things we take for granted are done through back-end processes, then that transforms the ability for people to activate and utilize these tools. And that's what we're finding. It's opened up doors for people to now utilize these tablets and other types of tools that I think many of us today take for granted. But for a good number of people, it's sort of out of the scope of what they can do.
Yep, absolutely. There's so much more we could do with the interface because they want to do those functions, but you know, it feels overwhelming to them. So when you facilitate them easily accessing, oh, I can see my grandkids. Of course I want to do that, right? Like, oh, I want to have my prescription reminders because I want to take them. Oh, yeah, I want that. But you have to make it in a consumable format. It's actually the same story for doctors when we're talking wearable data. They don't want the wearable data because we're giving it to them in a format that they can't use. But once we create it in a format that they can use, every one of them will demand it, right?
Well, I think, and that's the lesson that we've learned in terms of working with health systems and healthcare providers is that data flow into the EHR is not what people want. What they want is discrete elements that are relevant to the medical care that can then be pushed to the healthcare provider, which can then be digested. It's almost like drinking from a fire hose versus drinking a cup of water. And what we realize is that people want the cup of water, they don't want the fire hose.
Nice. Well, that seems like the perfect way to end this. So, you know, thanks so much to my special guest, Dr. David Rhew, Samsung's Chief Medical Officer. Also, shout out to Dr. Jimmy Vanagan and Dr. Chuck Webster, who joined us on the after party. If you want to find more of these videos, check them out at healthcarescene.com. And, you know, I also, for full disclosure, I should say that I'm a Samsung influencer blogger. So I've been working with you guys a little bit lately, writing about what you're doing and getting some inside peeks in what you're doing. So it's been a lot of fun, and I'm sure we'll have another opportunity. In fact, we already have it scheduled that after hymns, the Tuesday after hymns, we'll be doing another blab, and we'll be joined by Dr. David Rhew and also Dr. Nick from the CMO of Dell to do a after hymns blab where we can see, were we full of it or did we really see all of those things? And what other things surprised us that we didn't talk about in this chat? So thank you so much for being with us, Doctor.
My pleasure. Thank you very much for having me.